Welcome to Medication Administration Training, Module 3.
Administering medications safely. The 7 rights of medication administration. The rights of medication administration are a set of guidelines to adhere to when administering medications in an effort to reduce adverse medication events. Learn how to ensure proper medication dosages for the individuals you serve with this checklist of 7 questions. Number 1. The right drug. Ensure the correct medication ordered by the medical professional is administered. The right resident. Ensure the correct resident receives the prescribed medication. Number 3, the right dosage. The correct amount of the medication is administered. Number 4, the right route. The medication is delivered in the appropriate course. Number 5, the right time and frequency. The medication is delivered at the ordered time and interval. The right documentation. The medication administration record is signed immediately following administration. Number 7, the right reason. The medication is prescribed to benefit the resident.
Steps to giving medication safely. Always use the 7 rights of medications when preparing medications. The label on the blister pack must be cross-referenced to the label on the medication administration record to the medication in the blister pack at least 3 times. Once before preparing the medication, secondly while pouring and preparing, then just before administration to the resident. Always use the 7 rights to cross-reference to ensure labels match and the correct medication is in the blister pack. For example, ensure it's the right medication for the right resident at the right time and dose using the right route. Also ensure the medication is given for the right reason. Check the medication label on the medication administration record to ensure that the proper dosage is given and in the right way prescribed. Medication labels. The medication label on the medication container or blister pack will identify the pharmacy where the medication was dispensed. It will have the following clearly marked: resident's name, name of the medication, dosage, date of the medication was filled by the pharmacy, instructions for storing and administering medication, medical professional's name, and expiry date.
Steps to follow when preparing medications. Number 1, complete hand hygiene. 2, confirm allergies, changes in resident's condition, or changes in medications. Review medication change form if applicable. Check resident's name, medication name and dose, route, time and frequency of administration of the medication to be given on your MAR, medication administration record, using the 7 R's. Know the side effects and adverse reactions of the medications you are giving. If you are unsure, check the pharmacy fact sheet, contact your pharmacist, the resident's medical professional, the community health nurse, or health line. Check the label on the container and the expiry date. When administering the medications to the resident, staff must confirm resident identity prior to administering medications. Always use 2 identifiers every time. Identifiers may be name, date of birth, confirmation of identity from photograph on medication administration record, or confirmation of identity from another colleague. A resident may not always be able to tell you their name and date of birth. Administering the medications to the resident. When the resident receiving the medication has been identified, ensure the resident is sitting to prevent choking. Provide resident with water or juice to take the medication. Watch the resident swallow the medication and ensure all has been swallowed completely. observe the resident for adverse reactions, perform hand hygiene, sign your medication administration record immediately, ensure medications are returned to your medication cabinet and locked. Complete all steps above prior to administering to the next resident. Signing the medical administration record immediately is crucial for resident safety. A medication administration record is a legal document and can be used in a court of law. If a medication is not signed and it is assumed as not given, even if it was given. If a resident is urgently transferred to the hospital without the MAR being signed, the resident is at risk of being double dosed and/or given a medication that interacts with the medications they have received. Practical overview of medication administration. When administering medications, first you begin by washing your hands and ensuring you have gathered all of your supplies, med cup, water, applesauce, etc. Ensure you have read ShareVision and any medical appointment summaries that are relevant. You will be required to ensure you have a quiet space and time to do the medications. For example, do medications during downtime. Ask your coworker to assist in engaging residents if needed, or if you work alone, explain to your resident you are going to do meds and there needs to be quiet time. Unlock the medication cabinet and take down the MAR binder, blister, and any other medications for the first resident you will be giving medications to. Using your 7Rs, cross-reference the label on your MAR to the label on your blister to the medications in the blister pack. Check for any medication changes in the binder. Remember, you must do 3 checks. As you begin to prepare the medications and punch the medications out of the blister pack, complete your 7Rs for the second time. Prior to giving the medications to the resident, you will complete your checks again. Identify your resident using 2 identifiers, name and picture on the MAR, or verification from your coworker. After the resident has taken their meds, ensure they are sitting up, provide water, and engage in conversation to ensure all medications have been swallowed. Sign your MAR sheets immediately and lock up all medications in the cabinet. Start process for the next resident if applicable.
Hello, I'm going to do a series of short videos to demonstrate the process of medication administration. First, before you begin, you must read all relevant information on ShareVision. Gather your supplies, gloves, med cups, water. As you work, avoid interruptions. Keep the door to the medroom closed and do not take telephone calls. Follow the no interruption zone policy. Communicate to both your coworkers and your residents that you require quiet time to administer meds. It is your responsibility to ensure that you have quiet time to administer medications. Arrange the medications in the med room. Medications, MAR binder. Ensure you complete medication count prior to administering medications. As you can see, we're administering meds for John Doe. John Doe has one medication that requires counting. It is lorazepam, 1 milligram. You will complete your 7 checks on this medication to make sure that it's the right resident, the right medication, the right dose, the right time, and the right person. We will put on gloves to count a medication. You would use a med count tray. You take out the medications, 1, 2, 3. You would then sign off the date, time is 8 a.m., 3 medications, 3 caps, and you would sign off your initial. In the next video, we will continue the process of medication administration. When administering medications, there is a 3-check method. We will begin with check number 1. We do 3 checks to ensure that there are no steps missed along the way and that you are ensuring that everything is correct in the medications that you are going to administer. Now we can move into doing our checks with our meds using your 7 R's, cross-referencing the label on the MAR binder to the label on the blister pack. We will begin by confirming the resident, John Doe, John Doe. Then we will start with medication number 1, metformin 500 milligrams, metformin 500 milligrams. The right dose, 2 tabs, 2 tabs. The right time, 8 a.m., 8 a.m. The right route, which is tabs by mouth. The right reason, he's a diabetic and you know that this medication is used to control diabetes. Moving on to med number 2, diazepam 5 milligrams. The right med, diazepam 5 milligrams. Right time, 8 a.m., 8 a.m. The right dose, 1 tab, 1 tab. The right route, which is by mouth. The right reason is anxiety. And you're confirming not only that those medications are right on the MARS, but they're also in the blister pack. So you will go back to metformin. You confirm that there's 2 white pills as indicated on the blister pack, 2 round white pills. Diazepam, there's 1 pill in the blister pack, 1 small white pill. We move on to risperidone, 1 milligram. The right med, risperidone 1 milligram, the right dose, 1 tab, the right time, 8 a.m., 8 a.m., the right route, which is by mouth, the right reason is psychosis, and it also indicates that it's a small a white oblong pill, which is indicated on the blister pack. Look in the blister pack, there's 1 white oblong pill in there. And then you move on to the next medication, which is lactulose, 667 milligrams per milliliter. Take 2 tablespoons once daily when required. This is a PRN, so you take your PRN out and you confirm your label, 2 tablespoons once daily when required. Lactulose, 667 milligrams per milliliter. And then it is a PRN, so you have to locate the PRN guidelines. You go back to the PRN guidelines. For John Doe, if no BM, after 2 days, administer 2 tablespoons of lactulose once daily until there's BM. You locate the BM chart in the back of your binder, and it does indicate that John has not had a bowel movement for 2 days. This means you would be administering the lactulose at this time. This completes check number 1. Now we're ready for check number 2. Check number 2 must be completed prior to popping the medication out of the blister pack. Using your 7 R's, you're going to cross-reference the label on the MAR binder to the label on the blister pack. First, you will cross-reference the right resident, which is John Doe, John Doe. Starting with med number 1, you'll make sure it's the right med, metformin 500 milligrams, metformin 500 milligrams, the right route, tabs by mouth, the right dose, 2 tabs, 2 tabs, the right time, 8 a.m., 8 a.m., and the right reason. You are aware of John Doe's diagnosis of diabetes, and this medication is used to treat diabetes. You will then reference the medications inside of the blister well, which is round white pills, 2 tabs. You look in the blister pack and you see 2 white round pills. Moving on to medication number 2, diazepam 5 milligrams. Diazepam 5 milligrams. The right dose, 1 tab, 1 tab. The right time, 8 a.m., 8 a.m. The right route by mouth. The right reason, anxiety. Then you will check the medication, small, round pill. You will look into the well and locate the small, round pill. Moving on to medication number 3, risperidone 1 milligram. Risperidone 1 milligram. The right route, tab. The right dose, 1 tab, 1 tab. The right time, 8 a.m., 8 a.m. The right reason is for anxiety. You move to the next medication. It's lactulose, and it says take 2 tablespoons once daily when required. You realize that this is a PRN, and there should be PRN guidelines for that. So you look back through the MAR binder, and you locate the PRN guidelines. Lactulose PRN guidelines. If no BM after 2 days, administer 2 tablespoons of lactulose once daily until there is a BM. You need to locate now the BM chart to see when this particular resident has had bowel movements. You go back through and you realize that they have not had a bowel movement for 2 days. Thus, you do need to administer this medication at the time. So you need to open the medicine cabinet, locate your lactulose, and you now complete your 7 R's, cross-referencing the label on the lactulose bottle to the label in your MAR binder. It's the right person, John Doe. It's the right medication, lactulose 667 milligrams per liter, lactulose 667 milligrams per liter, and the right dose is 2 tablespoons, 2 tablespoons. It is the right time because you have indicated that they do not had a bowel movement for 2 days. Then it's the right reason because he needs it when he hasn't had a bowel movement. You are now looking through the MAR binder, and you notice that on a separate page there is a temporary med of antibiotic, and you did not realize this during your first check. So you go into the cabinet and you find your temporary med of antibiotic, and you do now your 7 R's, cross-referencing the label on the vial to the label on the MAR binder. So it's the right person, John Doe, the right med, amoxicillin 500 milligrams. The right dosage is 1 pill at 8 a.m., 8 a.m. for 10 days, and this is a temporary med. You have now completed your second check, and you are ready to prepare your medications. After completion of check number 2, you are now ready to prepare your medications. Prior to administering to the resident, you must complete your final check. Now I'm going to put in our antibiotic, 1 tab, and pop out our pills from our blister pack, making sure that there's nothing stuck in around the sides. And I'm going to prepare our lactulose. Remember, you must get down at eye level to ensure that you have the right amount. 2 tablespoons. Now we're gonna complete our final check. You will review the meds again. Metformin 500 milligrams, metformin 500 milligrams, 2 tabs, 2 tabs, 8 a.m., 8 a.m. The right reason is diabetes. Then you check in your cup to make sure that there's 2 white tabs as indicated on the blister pack. Moving on to medication number 2, diazepam 5 milligrams, diazepam 5 milligrams. Take 1 tab, which is the right dose. Take 1 tab at 8 a.m. 8 a.m. The reason is anxiety. Then you look in your cup, making sure that you have the small white round pill that's indicated on the blister pack. Moving on to risperidone 1 milligram. Take 1 tab twice daily. Risperidone 1 milligram. Take 1 tab twice daily. You have 8 a.m. right time. 8 a.m. right time. This one's for psychosis. And you look in the blister. It's a white oblong pill. You see the white pill in the cup. Now you have determined that you have the right medications in. You do your check of your antibiotic, which is amoxicillin 500 milligrams, straight med. The right dose is 1 pill. The right time is 8 a.m. and it's a temporary med. John Doe. Then you check your lactulose, which is John Doe, right med, lactulose, right dose, which is 2 tablespoons, once daily when required. And you've also checked about the guidelines. If no BM after 2 days, administer 2 tablespoons. You check the bowel movement chart again. You have verified that there has not been a bowel movement for 2 days. You have everything, all of your checks completed. You know that there's 2 tabs, 1, which is 4, and your antibiotic, which is 5. You have 5 pills in here, and you have 2 tablespoons of lactulose. You are now ready to administer to the resident. Once you've completed your final check, you are now ready to administer the medications to your resident. First, you must lock away your medications in the med cabinet. It up. You proceed to the resident, or you have the resident come to you if possible. You must use 2 identifiers to ensure you are administering to the right person: a photograph on the MAR binder, confirmation from your coworker, or stating the resident's name when you present them to the meds. So you would say, "Hi John, it's time for your meds. Would you like some water with this?" And you would have your cup ready. You give the medications to your resident to take, and then you make sure that they're sitting up. You're chatting with them for a period of time afterwards to make sure that they have swallowed everything, to avoid any hoarding tendencies. Make sure that they're not choking, and you're aware of any allergic reactions. Now you're ready to proceed to your documentation of your MARS. You go back to your med binder and you go through your meds, and you sign for your metformin, 2 tabs, which you know you have prepared for your resident. You sign for the diazepam 5 milligrams you just administered, risperidone 1 milligram. You indicate the time that you administered the lactulose, which is 8 a.m., and you initial below, and then you move over to your antibiotic, which you administered at 8 a.m., and you sign off on that. It is important to remember that the right documentation is that you sign your MAR sheets immediately after administering to your resident.
Overview. 6 steps to administering medications safely. Number 1, use the 7 rights of medications when reviewing medications. 2, read the medication label on the container or blister pack. Step 3, record the medication. Step 4, observe, evaluate, and report. Step 5, store medication in a safe place. Step 6, be aware of any residents who self-administer.
This concludes the Medication Administration Refresher Training for Module 3. You will be required to complete a test at the end of this slideshow. This can be located on ShareVision in the training section.